Detecting cervical cancer. Tonight, a closer look at something some doctors are saying parents need to consider for their young daughters now.
It's a vaccine you may have seen the ads for, Gardasil, stopping the virus causing cervical cancer with a shot. But there is a controversy. It needs to be administered before a girl is sexually active.
And joining us now is Theodor Griggs from the University of Wisconsin Medical School. Thank you so much for being here, Ted.
Thanks for being here. Well, let's start off with HPV. For folks who may not be familiar with it, we've talked about it in the news a lot, but what is this? What is HPV?
Yeah, HPV is actually human papillomavirus. It's a virus it's a sexually transmitted disease. 20 million people in the U.S. right now are infected with it, with a growing population, about 6.4 million people per year. And it's actually very clinically relevant because it's the #1 leading cause of cervical cancer, as well as genital warts. So. It's pretty important.
Yeah.
This is a very personal decision for parents, and that's why it's so controversial. Can you explain kind of, Wisconsin has not required the HPV virus for young girls, but what are the good things about potentially moving in that direction?
Right. Well, I mean, the great thing about the vaccine is that this is the first time we've really had a vaccine for this, for basically a prophylactic cure, a preventative measure for cervical cancer.
Right.
It can prevent up to 70% of cervical cancers. And the great thing about this is because, well, I should say, maybe not the great thing, but because it's a preventative measure, it's good to get these girls before they're sexually active. And so that's why there's this whole push for parents to get their kids vaccinated, at young ages, at around 12 years old. And ideally, they won't accumulate these harmful strains of virus.
So what's the problem? Why are parents concerned about this? What is the controversy here?
The main controversy that we've actually seen with parents is that there's this strange belief that getting an HPV vaccine, because it's a sexually transmitted virus, is going to increase sexual promiscuity, sexual behaviors with very young girls, young boys and girls, because the vaccine is actually approved for both men and women.
Gotcha.
And the results are that's just not true. I mean, we vaccinate children with hepatitis B vaccine, which is another sexually transmitted virus, but that does not increase intravenous drug use. It does not increase sexual promiscuity in children as is. And so it's a very great
It sounds almost like the same debate that we've had in the past about sex ed in health classes, and you're going to teach this, kids are going to do it. When in your sense, what you're telling us that's really not going to happen.
Right. I mean, actually, kind of going along the sex ed debate, I think the decade prior to 2002, when they started providing condoms in schools, when they started upping the sex ed education, actually the rate of teen pregnancy actually decreased, and then the rate of actually sexually active teens using condoms increased. So the results just speak completely against these moral oppositions to the vaccine.
So, so as a doctor, speaking as a doctor, you're saying it's better for girls 11 and 12 to get this vaccine instead of waiting a little bit longer as they're closer to adulthood because of the strains. You can catch them the earlier. Okay.
I mean, the main thing to understand is that this is preventative. It is not going to get rid of the virus after these girls have been infected with it. I mean, parents they should be afraid of their girls, being hypersexual at such a young age, but because this vaccine will prevent this when they eventually become sexually active, you don't ever have to worry about getting these strains of virus that will cause cervical cancer. 70% of cervical cancers.
Okay. Talk to your doctor. Some good advice, though.
Very personal decision as well. Thank you so much for being with us, Ted.
All right, we're right back.